Okay, so yes, I developed RSD back in 2002 after a car accident. Before that, I was a cheerleading and dance coach at Washington State University for 8 years, and before that, I did cheer and dance training and gymnastics since I was 4 years old. So I was very active, very athletic, very health conscious, ate all the right things, worked out almost every day. And all of a sudden, I was in a car accident that lasted 8 seconds. It changed my life forever. And I had nobody to help me through the process. I had doctor after doctor after doctor. It ended up being 43 healthcare professionals of all different types that saw me, that didn't put the big picture together and figure out what was wrong. First, they thought, I had thoracic outlet syndrome because my face and neck and shoulder were swollen. It was cutting off blood flow. So thoracic outlet syndrome, let's take out your rib. That caused major damage, and it wasn't thoracic outlet syndrome, it was reflex sympathetic dystrophy. So that started the process rolling and started the progression of the RSD, or CRPS at that point. And when they took out my rib, they messed up my lung. They left a nerve hook going into my nerve bundle from my rib, and another one going into my lung. So I had 5 lung collapses. One was a major collapse where my life flashed before me. From there, I basically wanted to help other patients. What happened to me should never happen to anybody. You should not have to see more than a couple of doctors to figure out what's going on. I'm asking, why am I discolored? Why is this going on? As I had each surgery, I had shoulder surgery, I had tumors growing in my mouth from medication that they had to cut out. So then I started having trouble with my teeth and the whole facial burning and discoloration that doctors should have seen from the beginning, but they didn't put it together. So after almost 3 years, I finally got to the right doctor, and he said, I think you have this thing called RSD. I said, there's no way I have RSD. I looked that up online like a year ago, and I asked the doctor if I had it, and he said, 100% sure you don't have it. He never did any type of testing. He never did anything. So this doctor finally says, okay, let's do a nerve block and see if it helps. And it helped for about 2 hours. And before I got the nerve block, my arm was curled up. And within 15 minutes after the nerve block, I was straightening my arm, and I was able to do this. 2 hours later, when it wore off, my arm curled back up. And I wished I had never moved my arm in the first place because I paid for it. My body had to readjust to that major level of pain all over again. And as this progressed through the years, this was 2005, so 2002 to 2005, no diagnosis, just doctor after doctor with complication after complication. 2005, I finally got to the right doctor. I started doing radiofrequency ablations and nerve blocks every 6 weeks until 2008. Well, in 2007, I wanted to start helping other patients so that they didn't have to go through what I had to go through. And my family jumped on board, and I was in bed most days. I was vomiting most days. I was about 12 pounds lighter than I am now, just from being sick all the time. And my family came together at one of our family meetings each year and said, let's do something so that this doesn't happen to other people. So we started the Power of Pain Foundation. In the first year, our focus was just on RSD. But we saw a need for to include and collaborate with other nonprofits and with other types of pain conditions because we're going through similar issues, not only with the pain, but with the dystonia and the discoloration and the sweating and the swelling and the vertigo and the vomiting and all the other things that come with having a chronic pain condition, your immune system being lowered. So the family started doing events all over the country in 2007, and I started writing my first book about what my experiences were from 2002 until 2009 when my first book first came out. I basically in 2009 finally got into, after being on a waiting list from 2007 to 2009 for Dr. Schwartzman to do ketamine, I finally got in and did the ketamine. I went in, I was in a scooter. By this time, by 2007, I was full body. I was in a scooter. I had dystonia in my foot as well as my arm and hand. I basically needed help doing everything. And then in 2009, when I finally got the ketamine and I went into remission, I took a more active role in our foundation and started going out and doing motivational speaking around the country, as well as signed over the rights to my book to our foundation to help fund patient grants to help other patients get the procedure that I got. And we also fund for other procedures as well, because different things help different patients. So you don't know if it is going to help you just because it helped your friend Susie. So we want to make sure that we're covering all different types of neuropathy pains, neuropathy conditions. And this quilt right here that you see, that's the National RSD Awareness Quilt that's being made. It's a huge panel of quilts. And we were one of the collaborators with getting people to send in their squares and getting them put together and that type of thing, and helping it grow to raise awareness for RSD. But one of the things that we did in Virginia is we went to the legislators and said, we would like to have an RSD Awareness and Research Act passed here. And they said, okay, let's start looking into this. What does it mean? How much is it going to cost the state to implement this? And they sent the paperwork to the state health commissioner, who we had tried to get into and meet with, and she wouldn't meet with us. So once the legislatures, House Representatives people started calling, she looked at it and she said, this is great. Why do we need a law? This should already be passed. And before she even got back to us, she already had a page up on the website, and then got back to us and said, I put this up last week, but I want to have a meeting and see what else we can do. How can we collaborate? What can we do? So we went in and had this meeting and ended up this November, this was last year, so this November is National RSD Awareness Month. And in Virginia, we got the governor to do a proclamation for RSD Awareness Month. And we also got funding for 10,000 pamphlets on RSD to be printed and put into every single state health facility in the state. Without going to the legislation and getting them to bring us into the front door, we never would have been able to get that partnership going. We tried. We weren't able to do it on our own. In California, we just passed not we, but I was part of the collaborative effort in passing a prior authorization bill for medications. And this just went into effect. The governor signed it, I think, a week ago into law. And there was over 30 foundations that came together that basically, by working together, we got it passed. The first year it went through the legislation, it got stalled. The second year, all these groups came on board, and this year we got it passed. So that's another way. If you collaborate, you can get things to happen. And then on our patient side, one of the things that we started doing is patient mentoring, but also patient advocacy, where we will hook up patients with other patients in their area. For instance, with me, I did the ketamine procedure. I was flying back and forth to Pennsylvania from Arizona to get this procedure done. And I found a doctor in Arizona. He owns 12 clinics. There's no reason why he can't offer this ketamine boosters or ketamine infusions. And got to sit down and talk to him through our foundation, and he decided that this was something that they wanted to offer. So he has 5 doctors now underneath him that are offering the booster therapy to other patients. What we do is have a patient that's been through it, whether it's an MS patient going with another MS patient, for me with RSD going in with other RSD patients. We actually go into the visit with the patient so that we can help them ask the educated questions, use the most time, that 5, 10 minute, 15-minute session with that doctor to get out on the table what needs to be asked, what needs to be conveyed, what symptoms that they're having, that sometimes we have cognitive problems. So we can be there to help each other in the doctor's office. And the doctors really seem to appreciate it, so that we're not wasting their time and they're actually able to give the patient better care, as well as after the patient leaves. The patient can't always just call the doctor up and say, hey, doctor, this is what's going on. They can call their mentor and say, hey, this is what I'm going through. Is this normal, or is it something I need to go to the hospital for, or do I make another appointment? What do you think I should do? And, we're not a doctor, but we have been through that process of whatever the treatment is that they're going through, so we're able to collaborate with the patient and with the doctor. And then on the other end of that, we have the doctors. For instance, with me and ketamine, that are able to call the doctors in Pennsylvania who put me into remission to say, okay, it's looking like Barby was injured. She's come out of remission. How many days of ketamine should we give her? What's the dosage we should give her? And they can collaborate, doctor to doctor, as well as the patient with their patient mentor to get the best care. And if we could work that type of system in where doctors could be, you're the experts, to have you guys talking to other doctors who don't know, or they're new at it, or they want to do the procedure, but they're afraid. If we could get some kind of consortium together or alliance together where the doctors could call you, or you could call a doctor in a particular area and say, I know you're interested in doing this procedure. Here's the steps that you have to go through to make sure that you're offering it correctly and benefiting your patients the best. I think that would be a really great way to get us all working together and create another big picture to add to the puzzle of what's going on in the neuropathy community. So, thank you.